Okay, so I generally start with the numbers and give folks kind of a up to the moment sense of what's going on at the state level, the county level, and then what's going on at Kaweah specifically. So this is reported just as of late yesterday by the state. We now have just slightly more than 190,000 positive COVID-19 cases up and down the state. That's out of 3.6 million COVID-19 tests that have now been conducted statewide. So you hear me speak a lot about the positivity rate. So that positivity rate is determined by taking that 190,222 positive cases and dividing it by the 3.6 million tests that have been performed. That translates into a positivity rate of 5.3%. So that is the average positivity that's been experienced in the state of California since the outbreak of the pandemic. So that does not necessarily reflect the positivity rate that we are experiencing today. And so we know that when you go back to the early phases of the pandemic in March, and really when it started, I wouldn't say it was peaking in April, but definitely it was in full bloom, so to speak. The positivity rate was much, much higher back then. But then it has come down over the last several weeks, only to start rising again. And I'll talk about that in a moment in terms of how we're seeing that here in Tulare County. And again, the California Department of Public Health last night did report that from a trending standpoint, both that positivity rate and another very important measure is what we call the hospitalization rate. So what percentage of those patients that test positive actually end up becoming hospitalized. So both those key metrics have been trending up over the past 14 days. We've had, unfortunately, 5,632 deaths in California that have been attributed to the COVID virus. And again, if you take that and you divide by the 190,000 that have tested positive, roughly 3% of those that have tested positive for the virus also succumbed to the virus. There are currently 4,095 COVID positive patients that are currently hospitalized, with about 1/3 of them in the intensive care unit, 31%. And again, as I've mentioned every week, healthcare workers, not only are we not immune to the virus, but we're on the front lines, or not speaking for myself, or at least speaking for our nurses and our physicians and all of the folks that are taking care of our patients in the hospital right now who have the greatest exposure. They have contracted the virus, and statewide, just shy of 14,000 healthcare workers have tested positive, and sadly, 85 of them have passed away, really in the line of duty. At the county level, again, just keep that in perspective, 190,000 positive COVID cases statewide. We have 3,533 positive cases here in Tulare County. This was as of last night's reporting. It's been some time since I gave you the breakdown, the age distribution of those cases, so I thought I would give you an update on. So 3,533 positive cases. 11% of them are 0 to 17 years old, 14% are 18 to 25 years old, 24% are 26 to 40 years old, 33%, so 1/3, the greatest percentage, are 41 to 64 years old, and only 18% of those that contracted the virus are over 65 years old. But it's that 18% that has had the greatest difficulty successfully beating the virus, and that's where the greatest number of deaths have occurred in that age population. We have had 118 deaths now across the county. 92 of those deaths relate to nursing home patients. So again, the vast majority of deaths have occurred in the nursing homes, and that's just concentrated just in 6 nursing homes. There are about 17 nursing homes county-wide, but just in those 6, we've seen 92 deaths. Those 6 are Redwood Springs, Linwood Meadows, Lindsay Gardens, Dinuba Healthcare, Sierra Valley Rehab in Porterville, and Kaweah Manor. And the vast majority of those deaths have occurred in Redwood Springs, Lindsay Gardens, and Sierra Valley Rehab. As of right now, county-wide, we have 56 COVID-19 patients that are currently hospitalized. The majority of them are hospitalized here at Kaweah Delta. We currently have 40 positive COVID patients that are in-house. So the other 16 patients are currently hospitalized at Sierra View Hospital in Porterville. The positivity rate for the county, I mentioned to you last week that that number was being routinely reported by the county, but unfortunately it's disappeared off their website. I did have an opportunity yesterday to speak to some of the county leaders and ask them to put that information back on the website. It's incredibly important. It's one of the most important metrics for our county to get a sense of are we doing well with our practices and behaviors, or are we not doing so well? But it also gives the hospital kind of a barometer of what we need to be gearing up for. So if we see a rise in the positivity rate, that's generally associated with a rise in the hospitalization rate. So the county shared with me yesterday that the county-wide positivity rate has now reached 9%. Just a few weeks ago, we were down to 5.7%. You recall that to move to phase 2.5 under the governor's reopening plan, a county had to be below 8% for 7 consecutive days. So we certainly fell below that and fell as low as 5.7%. But like what we're witnessing across the country and across the state, Tulare County has also now starting to see a rise. We definitely were seeing an increase in the number of cases, but that's more driven by just the amount of testing that we're now doing. But the sheer rise in the number of cases is a product of more testing and a higher positivity rate. So that 9% positivity rate, it's really interesting. I don't think the state is going to continuously measure counties, and if you rise above that 8% factor, do they push you back out of your current phase into a lower phase until you achieve the metrics again? So I haven't heard that is being considered. I've actually heard nothing about it whatsoever. But independent of that, it is very disconcerting to see the positivity rate rise to the level it has. And again, then to take it down to Kaweah Delta level, I mentioned we have 40 positive patients in-house. That's probably the highest that we've experienced throughout the pandemic. Again, just a couple weeks ago when our positivity rate was down to 5.7, Kaweah Delta had an average daily COVID census of about 25 patients. So they definitely are going hand in hand. The higher positivity rate, the higher number of hospitalizations that Kaweah Delta is seeing. Of those 40 cases, 8 of them are housed in our ICU right now. 7 are on 3 West, which is an intermediate critical care unit, but it is critical level care. 24 patients on our dedicated respiratory unit, that's 2 South, and we currently have 1 patient holding in the emergency department that's waiting for an intermediate critical care bed to open up. In terms of just what Kaweah Delta has experienced, again, 3,500 positive cases countywide. Kaweah Delta has tested over 1,000 of those cases. So between the county and Kaweah Delta, we are testing the vast majority of those 3,500 cases. Again, another interesting factoid, of those 1,040 positive cases that we've tested, 164 of them were inpatients, of which 106 or 64% came from those community nursing homes. So again, almost 2/3 of the patients that have been admitted to the hospital that tested positive for COVID did come from the nursing homes. But interestingly, more and more now we're seeing them coming from residences. So they're coming now from people's homes, not nursing homes. And then the vast majority of those tested positive that either came through the ED or one of our clinics or another outpatient setting. We've had 125 employees that have now tested positive since the inception of the pandemic. Fortunately, a vast majority of them have recovered. In fact, 79 of those 125 have recovered. We currently have 45 of our employees that are quarantined at home, and every indication is that they're doing well and that they will fully recover, and we're anxious to have them come back to work. We still do have one of our employees that is hospitalized up in Fresno.
But Gary, if I could just add to that, this employee is doing well and is sitting up and now eating and talking, and so it looks like that it's going to be a long recovery for that individual, but definitely we're encouraged by her progress so far.
Yeah, that is wonderful news.
Yeah. I will say
Diane.
that we continue to have between 3 and 5 new positive employees a day. So about 20 a week or so are
Right.
positive, and that's about that's because of the community spread in part, and because of some work exposures as well. But we're having just about that same amount recover every week. So for the last probably 5 or 6 weeks, we've held steady with about 40 to 45 employees out in recovery at any given time.
Yeah, and I think that that's been the most positive news that we've been reading of late, is that we are starting to see more and more recoveries. I forgot to mention that of the 3,533 positive cases throughout Tulare County, 2,600
Yeah.
of them have recovered. So that's almost 3/4 of them have recovered. So really good to see that that we are being successful in overcoming this virus.
Just one more tidbit. We've had 4 physicians or providers that have been positive, and all 4 have recovered and are back to work. So I think that's positive as well. Good news.
Yes, very good news.